Hello, welcome back. Dr. Goforth here at Cornerstone Physical Therapy. I'm one of the pelvic health specialists here. Today, we're going to be talking about how to squat during pregnancy. Number one, if squats weren't part of your practice before becoming pregnant, just kind of clear that with your doctor. Don't go too crazy. In general, they advise not getting into too much aggressive exercise if it's something new that you did not do prior to being pregnant. For example, like running, high impact activities like that, squats or loaded squats, just things to be cautious of. Make sure you clear that with your physician first and foremost. But let's just jump right into it. We're going to talk about a few different tips to think about with squats, whether you're pregnant or not, but especially if you're pregnant. So I'm going to step away from the camera to stand. So hopefully you can see my hip angle, my low back position a little bit better, and then we'll recap here at the end. Okay. Let me move this chair out of the way. So in general, whether you're pregnant or not, we want to think about what we call a hip hinge when you're squatting. So I'm going to turn to the side, and I might step back a little bit more. There we go. You can kind of see, here's my hip joint right here on the side that you can visualize. So we want to pretend like our hip joint is like a door hinge, meaning I'm not going to squat like this. I'm not going to round my spine. I'm going to try to keep my whole upper body from the hip joint up as one unit, and it's going to look something like this. See how I'm mostly staying straight throughout my torso? So that's number one, pregnant or not. That's something to think about. Number two, when you're pregnant, if you watch the other video that I just did here a little bit ago, you have increased of that lordotic posture in your lumbar spine. So if this is, let's say you're normal when you're pregnant, I'm exaggerating, but there's more of that curve to your spine. So you want to kind of protect your back a little bit more. So things to consider are don't go maybe as far down in depth, because if we think about what the low back has to do, it's not going to stay totally straight, especially as you get further down in your squat. Your back's going to want to go into that extended position a little bit, which is normal, but if it's already extra extended, you might not want to go down to like parallel thighs to floor. Now, if it feels fine and your doctor's okay with it, especially if you did it before being pregnant, go for it. But just listen to your body in general is a good thing to think about. One thing I like to tell my patients, pregnant or not, is do a little bit of what I call the tail tuck. So if this is, my hands are on the top of my pelvis, if I tuck my tail to start and think about keeping that tuck as I come down, I'm hinging from my hips. See how my low back stays a little bit more straight, and I can really feel my glute muscles even helping me more. That's a really good thing to do. The last, or a couple more things to think about. One, when you're pregnant, especially the further along you get, your abdomen's more in the way of your thighs, your legs are going to have to be a little bit wider. So, if your feet were normally like your pelvic width, take them out a little bit. It's going to be more comfortable. Just accommodate for baby kind of being in the way as you come down. And the last thing I was going to mention is, especially as you get further along, you may or may not need some arm support, but TRX straps or holding on to the back of a couch or chair that's sturdy as you go down into your squats, just to kind of play it a little safer, make sure you're feeling okay, is a great thing to have as well. So that was kind of the quick and dirty on things to think about with squatting while pregnant. And again, first and foremost, just talk to your physician, your OBGYN. Make sure they're okay with you doing squats, just to make sure we're all on the same page. And if you haven't yet seen a pelvic PT and you're pregnant and you're noticing any low back pain or issues with incontinence or constipation, go see a pelvic PT and get checked out and see if there's something that could be helpful. Or maybe you want to do squats, but now when you try, you leak a little bit of urine. Go see a pelvic PT and let them check you out and see what their thoughts are on what the problem might be. And then hopefully you can get back to doing what you want to do. So hopefully that's helpful. Please post any questions or comments in the comment section below, and we'll see you next time.